Good afternoon. I am going to present 52-week results of safety and efficacy of optogenetic therapy for vision restoration in advanced retinitis pigmentosa. I was the principal investigator for the study. I have no financial interest, but all the papers related to ethical clearance and gene therapy related are submitted to scientific committee last year, because I presented the 16-week primary endpoint report in the previous AIOC. So why optogenetic gene therapy? It's because the available therapy for advanced retinitis pigmentosa, like use of electrodes, are invasive in nature and has limited resolution. And the classical mutation specific gene therapy requires presence of photoreceptors like the rods and cones, which are not available in advanced retinitis pigmentosa. But the optogenetic therapy targets the other cells available in the retina to modify them to photoreceptor cells, and that's why optogenetic therapy is a promising option. And here we introduce a special gene that enables the neurons to be stimulated in response to light. The earlier monochromatic opsins like channelrhodopsin, which are used, required intense light to be stimulated and produced suboptimal neuronal response, which requires wearing of goggles to stimulate the retina. But in contrast, the advantage of polychromatic MCO is that it is activated in ambient light, generates significant photocurrent, and does not need a glass to get activated. And the approach is to turn the bipolar cells into the photoreceptors. And the method is a very simple intravitreal injection of the MCO into the vitreous cavity. And the target cells are bipolar cells. So here is the flow, how the study goes. The key enrollment criteria is either perception of light or hand movement in the study eye, and no better than counting finger in the fellow eye, regardless of the RP gene mutation. The subjects were divided into three groups. First was the low group of 3 subjects. The second one was a higher group of 3.5 into 10 to the power 11 vector genome per eye, which was well tolerated, and the next group of 5 subjects were given the same dose. The demography showed that we have 6 males and 5 females in our study, and this is a panel of pictures showing neutralizing antibody in the serum of the VMCO treated RP patient, which are done at 4 weeks post injection, and none of the patients developed neutralized antibody to the injection. And here is the gene panel for the study subjects of advanced retinitis pigmentosa. Out of that, the most common gene was ABCA4, which was detected in subject number 5, subject number 8, 9, and 10. And here's the study safety profile, which shows that none of the subjects developed more than 2+ AC or vitreous inflammation. 5 out of 11 required no medical treatment, and 2 out of 11 had only moderate rise in intraocular inflammation, and 5 had moderate elevation IOP, which are well controlled with topical medication. More importantly, no subjects required oral steroid or glaucoma filtration surgery to treat the increased intraocular pressure. There was no detectable retinal toxicity assessed by OCT imaging. And the Freiburg visual acuity improved that few weeks after VMCO injection, subjects have more than 15 letters gain in 87% of the subjects, and more than 30 letter in 75% of the subjects. And here is the fundus autofluorescent photograph of the patient, which shows that the M-cherry expression is very good, which is being depicted by conversion of bipolar cells into the photoreceptor cells. And is a Y mobility test tells that most of the patients improved on mobility score. Here is a videos which one of our patient, when asked to move on Y mobility test to locate the light pre-injection and post-injection, you can see the behavior of the patient. This is the pre-injection movement, and you can see the patient is trying to locate the light but not able to do so, even if he comes very close to it. And this is same patient post injection, which when he's asked to locate the light, you can note the way he is moving and the way he is locating the light. So to summarize, there is very favorable safety profile with no serious adverse effect, mild increase in IOP and intraocular inflammation, which are well controlled with topical medication. There is no increase in neutralizing antibodies against the VMCO, suggesting no systemic immune response. And the dose-dependent efficacy was very good, which is depicted both in increase in visual acuity as well as functional vision in Freiburg visual acuity, Y mobility test, and NEI vision questionnaire functions. With this encouraging results, a randomized double-masked controlled multi-center phase 2 trial is on the way in US at 6 centers. I would like to thank my co-investigators and authors for this wonderful study. Thank you.
Santosh, what was the age group? Means you tried in which age groups?
The age group was more than 18, and it was the oldest patient was 73 years old.
73, 18 to 73.
Yeah, so no children were included because this is a new study which involves gene therapy. All the adult populations were only included.
Okay, very good, very innovative. Let's hope that it works.
As because sir, I have the keynote address of 16 weeks and this is 52 weeks. I want to just forgo that keynote presentation in interest of the competition.
You want to continue this?
No, I don't want to present because that's a 16 week.
Achha, okay.
I want to forgo
okay,
that.
Okay.
Because I am competing for.
Sure. Thank you.
Thank you.